Thank you very much for joining us on the program. Health workers have got the clear out, the all clear to use 3 experimental Ebola treatments in Uganda. It comes a week after the deadly disease spread over the border from the Democratic Republic of Congo, DRC. 2 people had then traveled from Congo and died in Uganda last week. A 3-year-old boy who was sent back to Congo after testing positive for the disease died at the weekend. But the UN Health Agency has said that there have so far been no known cases of Ebola spreading between people in Uganda. All recorded patients had traveled from Congo. Now, 4 experimental therapeutic treatments are already being used in Congo, and health workers and people who came in contact with infected people in Uganda have begun to receive a Merck experimental vaccine in Uganda since Saturday.
Well, Jerry, the threat is taken seriously in Uganda, even though officially there are no more confirmed Ebola cases in the country. However, the porosity of the border between the DRC and Southern Sudan creates room for fears.
We're now being joined by Irene Nakasita, spokesperson of the Red Cross in Uganda. Good morning. A pleasure to have you with us. Thank you very much for joining us on the program. There is a lot of information coming in regarding Ebola since cases were reported in Uganda. And there are rumors about a new case being discovered in another major town. How true is this?
Ebola case in Mbara is not true. That must be a rumor. Maybe you can ask the Ministry of Health can confirm, but the report, the press release I've seen from the Ministry of Health indicates that there is no confirmed Ebola case in Mbara. And for us, ever since the 3 confirmed cases, which actually all passed away, we have not received any fresh confirmed case of Ebola in Uganda. And so at all the border points, we are still doing screening, and we are actually, Red Cross teams are deployed at even the other porous borders that were not initially being manned. So we are deploying their teams to at least support the screening and monitoring. And also in communities, the sensitizations are continuing, and the ambulances still to support referrals in case there are any suspected cases. So apparently that's how far we are, but we do not have any fresh outbreak of Ebola in Uganda. That rumor case that was there in Mbara, the ministry report indicates that it's not Ebola. So that is where we are.
So, Irene, how are you dealing with this as the Red Cross?
The most important thing is to share information in a timely manner, because when they are scared, the most important thing we are doing is actually making sure, the ministry makes sure that samples are drawn from these suspected cases and then the tests or results are shared on time. And also we are using the media to communicate relevant information concerning all suspected cases and all the Ebola facts that we have in the country. So we believe this is one way we'll be able to manage the scares and rumors. But also the ministry has also been clear on communication channels, especially encouraging people not to, even media houses, not to just share any information they get the way it is without having it verified or cleared by the ministry. Because then this causes scares in communities and also misinformation, which is actually bad or hard to manage. So apparently that's how we are handling scares and rumors. But also, the airport is one other, actually the airport sits in a district called Entebbe. Entebbe, if you look at the areas that had been highly ranked for Ebola preparedness, even before this confirmed case, Entebbe was one of them, including Kampala and Wakiso. Kampala and Wakiso are business stop points, but Entebbe being the only airport point that we have in Uganda was also demarcated for Ebola preparedness. So apparently all areas that are bringing in people from outside Uganda, especially through Congo, are being manned. That's why I told you in the beginning that even the porous border points that we had not deployed at initially, we are deploying teams there to ensure that everybody who enters the country is screened.